My name is Candace Handapangota. I work downstairs in Human Resources. We also have Laura here from Blue Cross Blue Shield. We're glad all of you could make it today. And so for the next hour, we are going to talk about the 3 plans that are available to our retirees that are not Medicare eligible and do not have Medicare A and B in place. And so hopefully all of you grabbed a resource guide in the back. Laura has a PowerPoint presentation she's going to go through. I do want to mention, though, as we talk about these plans, if after the meeting's over you decide not to make any changes, we do have some default plans set up for our early retirees. So, for example, if you're currently on the $20 copay program through Health Partners and you do not do anything, and if you have family coverage, your spouse or family members will automatically transfer over to the Blue Cross Blue Shield copay program. If you have the Health Partners High Deductible Program, you and any of your family members that are on that policy with you will automatically transfer over to the Blue Cross Blue Shield Aware High Deductible Program. And as Laura goes through those, you will see they look almost identical to your current plan offerings. We also have a third new plan that we're offering, which is a high deductible program also paired with a health reimbursement arrangement account that uses Blue Cross Blue Shield's regional network that's set up a little bit differently. If you do decide to make any changes, we will need a Blue Cross Blue Shield enrollment form from you. And those are available here at the front desk, up here in front. We also have those downstairs in Human Resources. Or for those of you that have had an opportunity to look at the Anoka County Retiree website that's been created, we've also just added those out there as well. And we'll re-mention that again at the end of the presentation. But again, just want to stress this first hour is for our retirees who do not have Medicare in place or their family members that do not have Medicare in place. So with that being said, I'm going to turn the floor over to Laura.
Thank you. Good morning, everyone. What we're going to talk about today is the network of providers, your health plan. We'll talk about the pharmacy programs, the HRA, Blue Cross programs, My Blue Cross, and then we'll end with online care anywhere. And if you guys have any questions along the way, please feel free to stop me. If we start with the Blue Cross networks here, the first network that's being offered is the Aware Provider Network. It's the largest network in Minnesota. No referrals are needed for this network. That means that you can go to any provider or specialist as long as they're participating with Blue Cross Blue Shield. You do not need to get a referral from your primary care doctor in order to see a specialist. You'll see about 98% of doctors participate and 100% of the hospitals participate. So with the Aware Network, again, it's truly our largest network in Minnesota. You're going to find that the majority of the providers are participating. Many are not participating with Blue Cross. You're not going to find many providers that don't participate. And then you also have coverage when you travel. If we go to the next network that's being offered, it's our regional network. With our regional network, we tier our providers based on cost, not quality. So Tier 1 providers are going to offer you the highest benefit with a lower out-of-pocket cost. Tier 2 providers are going to offer you a lower benefit with a higher out-of-pocket cost. You have access to providers wherever you are. So in Minnesota, regardless of the network that you choose, whether that's Aware or regional, anytime you're traveling outside of the state of Minnesota, or if you live outside of the state of Minnesota or have dependents, whatever, you will use the National Blue Card Network. National Blue Card has about 96% of hospitals and about 92% of doctors. If you're traveling to a foreign country, you also have coverage in foreign countries through a Blue Card Worldwide network. So again, in Minnesota, it's Aware or regional, and then regardless of the network that you pick in Minnesota, everyone utilizes our National Blue Card network outside of the state of Minnesota. And then if you're traveling to a foreign country, it's our Blue Card Worldwide. And then lastly, the PPO suitcase will be located on your ID cards once you receive those in December. That allows providers to know that you have coverage with Blue Cross Blue Shield of Minnesota. Now, if you need to find a doctor on our website is bluecrossmn.com, and then down at the left-hand side there, you'll want to select Find a Doctor. It's then going to bring you to our network page. I've circled the networks that pertain to Anoka County, Aware and regional in Minnesota, outside of Minnesota, National Blue Card, and then outside of the U.S., Blue Card Worldwide. Again, 3 easy ways to find a doctor. You can log onto our website at any time, or if it's easier for you, you can call our customer service center at any time. They're aware that Anoka County is coming on January 1st, so you can begin calling today if you need help with finding your providers. The phone numbers are listed up here. They're also in your resource guide, and then once you get your ID card, they'll be on the back of your ID card. If you are calling into customer service, you'll want to make sure that you note which network you'd like them to search by. Aware or regional in Minnesota, and then outside of the state of Minnesota, National Blue Card. Any questions on the networks? Okay, we'll move into the health plans being offered now. The first plan that's being offered is the Aware Network $20 copay plan. If we look at in-network here, you'll see that there is no deductible on this plan. However, there is an office visit copay of $20. Your office visit copay will apply anytime you're seeing your primary care physician, chiro, physical therapy, speech therapy, occupational therapy. Again, anytime you're going into the office, it's a $20 copay. Once you've paid that $20, the visit is covered at 100%. Your out-of-pocket maximum is $3,000 single, $5,000 family. So what goes towards your out-of-pocket maximum are all your copays, your medical copays, your ER copays, and also your drug copays. So once you've paid in 2013 $3,000 towards your out-of-pocket maximum, everything is covered at 100%. All your medical claims and also your drug claims. So you will stop paying for any of those once you've paid $3,000. Preventative care is covered at 100%. There is no copay on preventative care. One thing I want to mention is that typically anytime you're going in for preventative care and you have any lab work done, or for example, you go in for a colonoscopy and something is found, it's no longer considered preventative, and your provider will send it in as illness, and you might be getting that $20 office visit copay. But just something to keep in mind, you'll want to have that conversation with your provider up front and ask them, you know, what extra tests are you doing? Or again, talk to your provider. If they want to code that visit as preventative and send that into Blue Cross, we'll pay the claim based on how we receive it. So just something to keep in mind. If you're getting a $20 bill for your preventative care, you want to talk to your provider about what that's for. Hospital care is covered at 100%. And then lastly, you'll see that there's a $75 copay on your ER care. So after you've paid $75, your ER visit is covered at 100%. Now, if you're admitted to the hospital, that copay is waived. You'll see that for emergency room, it's the same in-network and out-of-network. If you are truly in an emergency situation, we know that you obviously are not able to search for a participating provider. You go to the closest place possible, and your benefits pay at the highest level, the in-network level, if you're seeing an out-of-network ER facility. Any questions on the Aware plan with the $20 copay? Nope, we keep track of all that.
Okay, so if we pay more, then you'll send it back to us.
Correct. Correct. Sorry, Candace reminded me I should repeat the question. Her question was, do you need to keep track of what goes towards your out-of-pocket maximum, or do we, Blue Cross? And Blue Cross will keep track of what is going towards your out-of-pocket maximum. That's nothing that you need to do on your end. Now, the second plan that's being offered is the HRA under the Aware Network. So the Aware Network, again, is going to offer the $20 copay plan and then the HRA plan. And you'll see with the HRA plan here, there is a deductible. It's $2,000 single, $4,000 family. There are no office visit copays on this plan. Once you've paid your deductible / out-of-pocket, your coinsurance is 100%. So everything for medical and drugs, you're responsible for the first $2,000. Once you've paid $2,000 for 2013, your medical claims and also your drug claims are covered at 100%. Preventative care on this plan is covered at 100% as well, no deductible. And then you'll see hospital and also ER is 100% after you've met your deductible. Now, this is an embedded plan, which means that no one person can exceed $2,000, which is the single deductible. So if you have a catastrophic claim in 2013, for example, $50,000, the most you're paying is $2,000, and then you are covered at 100%. Now, if you have a family you'll see is $4,000. Again, no one person can exceed $2,000. So if you have a family of two, yourself and your spouse, each person needs to meet $2,000 before you're both covered at 100%, to cap at $4,000. Does that make sense to everyone? Any questions on how this plan works?
So if my husband used the 2,000 for him and I only used 200, if he had something go on with him that was major, then it's covered for him 100%?
Yep, so the question was, if her husband has $2,000 worth of medical claims and she only has $200, then is he covered? And the question, or the answer is correct, yes. He is capped at $2,000. So once he's paid $2,000, his medical and pharmacy claims are covered at 100%. Because she has only met $200 of her deductible, then she has that remaining amount to meet before she's covered at 100%. Good question. Question?
This is kind of a county question, but last year, and I read in your email, or your mailing, that any leftover HRA funds from this year would go to
Yep.
the new plan. Is there a copay? Is there any contribution this year from the account?
Yep, Laura's actually going to be getting to that slide when it pairs with the high deductible program with the HRA, but if you're the retiree carrying the coverage, there is a contribution to the HRA. It's $1,000 if you have single, $2,000 if you have family, and like you said, if you've been on this plan this year, anything you don't use will carry forward to 2013. We do just mind individuals, though, to note that there is a couple months lag time from Health Partners to Blue Cross Blue Shield with transferring those funds over, because we need to be able to process out all 2012 claims.
I have a question on the screen, prior screen on nowhere, on the deductible. If you have one doctor that's not in the network, it's out of network, that goes to the $2,000 deductible, you have to pay the whole thing.
Correct. So if you're seeing out-of-network providers, you have that separate deductible to meet, that $3,000 single, $6,000 family.
So you have $20 for your doctors that are in it, and then everyone that's outside, that would be a part of the $3,000.
Correct. Any other questions? Yes.
Is there a chart in here anywhere that shows the difference in prices for the plans?
There's not in the presentation material we're going through. If you haven't gotten your open enrollment letter yet, you should be getting that any day. We do have that in there. Otherwise, I do got just a copy up here that you can take a look at to see the difference. I also know we have Kathy Cook here in the back, where after the meeting, if you want to touch base with her, I know she has copies of the rate sheets that she sent out if you want to see for your light plan what that cost is. And he just asked about the cost of the plans for 2013.
Any other questions before we move on? Yes.
The in-network and the out-of-network, if you're out of state, are you still in-network if they part of that?
The question was, if you are in and out of network, if you're out of state, how does that pay? If you're out of state, and again, you're using that National Blue Card and you're using a participating provider with Blue Cross Blue Shield, it pays in-network. So whatever your coverage is in Minnesota, that's the coverage you have outside of the state, as long as it's a participating provider. Good question. Any other questions before we move on? Okay, next we're going to talk about that regional network. So again, under the Aware network, we're offering that HRA plan and also the $20 copay plan. Under the regional network, we're offering just the HRA. And you'll see here we have the tiers. You'll see tier 1 is the same exact coverage as the Aware network HRA. So tier 1 here, the deductible is $2,000 single, $4,000 family. That's the same for the out-of-pocket. So once you've met your $2,000 single, coinsurance is 100% in tier 1. Preventative care is covered at 100%, no deductible for tier 1 and tier 2. And then hospital care is 100% in tier 1. Now if we move to tier 2 there, you see that the benefit drops a little bit. There's more out-of-pocket for you. You'll see the deductible is $3,000 single, $6,000 family. There's no office visit copays on this plan as well. And then the out-of-pocket maximum is $4,000 single, $6,000 family. Your coinsurance, after you've met your deductible, is now 80% in tier 2. Preventative care is still covered at 100% in Tier 2, and then hospital care is 80%. So with our regional network, what it's doing here is tiering our providers based on cost. So if this is a network that you choose, you want to check to see if your providers are either in Tier 1 or Tier 2. The more expensive providers are going to be in Tier 2, for example, Mayo, HCMC, Health East, etc. One thing to note about the regional network here is that the deductibles and out-of-pockets do not cross-apply. That means that they do not accumulate together. So if you're seeing Tier 1 providers, you're following that schedule of benefits, that deductible and out-of-pocket. If you then start seeing providers in Tier 2, you're following that separate deductible and out-of-pocket. They're not going to accumulate together, they accumulate separately. So potentially, if you're seeing providers in Tier 1 and Tier 2, you have a deductible for single of $5,000. So again, you just want to make sure that you check your providers to see where they fall. And if you find that some of your providers are in Tier 2, this probably wouldn't be a good plan for you. Any questions on the regional plan?